Good evening, everybody. We'll just wait a few moments for a few more people to join us. You're definitely in the right place. This is the virtual event from Care Fertility this evening. Welcome, everybody. We'll get started very soon. Just remembering how to drive this. That's fine. Okay. So, really warm welcome to everyone joining our virtual information evening. I'm Alison Campbell. I'm Care Fertility's Group Director of Embryology, and tonight I'm hosting this event. So what you can expect, it's going to last for around 40 minutes. We have 3 short information videos about Care Fertility and all about our experienced team. I'm going to walk you through the IVF treatment pathway from consultation to embryo transfer. I'll show you some diagrams, photographs, videos, and all sorts of interactive things going on. And this is going to be interspersed with 2 Q&A sessions with myself and Professor Charles Kingsland. So you can ask questions in the private questions tab or else in the public chat. If you use the chat, then everyone at this event will be able to see your first name. You're also able to ask questions via email. That's events@carefertility.com. And if we don't have time to answer your questions during this event, we will send a reply to your question via email. If you think of anything after the event, our patient events team will reply to you as soon as they can. So that's events@carefertility.com email. So I'm very pleased to say that our new patient inquiry team are available until 8 o'clock this evening. The number to call them on is 0800 564 2270. So we're going to get started with a short video just to get you, to introduce you to care.
Family. It's who we are and who we're always going to be. It's the important little moments, the big emotions, the beating heart at the centre of our world. It's the journey that we take there, together, one step at a time. Family is the one thing we'll always care about the most, because we believe that family is for everyone. And through our care, we'll do everything we can to make your dream real. We don't just care, we are care.
My name is Professor Charles Kingsland, and I'm the Group Clinical Director for Care Fertility. At Care, our number one belief is family for everyone, and this means we do everything possible to help everyone start or grow their family. We know that nothing is as important as family, and that's why we care so much about wanting to give every patient that comes to us their best chance of having a baby. Of course, families come in all shapes and sizes. We get heterosexual couples, couples of the same sex, we get single patients wanting to start a family, we get NHS patients. When you have a fertility problem, there should be facilities available for you to get the best advice and the best treatment readily available to give you the best chance of having a baby at a time in your life that is best for you. We will use all our knowledge and experience combined with highly individualized treatment, personal treatment, to help you have the family you are longing for.
Unbeknown to Gemma and I, we both carry a gene, a deafness gene. We actually have a daughter who was 3, but who was born prematurely deaf. And we were given the option and chose to go down a fertility treatment to kind of avoid our second child having that same gene.
We were very lucky in the fact that the clinic was only down the road from us. So we felt there was one around the corner. It had good reviews. We just felt it was good for us, didn't we?
The whole package made us just feel really comfortable that actually going with Care was the right decision.
So the team that we worked with at Care were unbelievable. They were caring, they were sensitive, they were compassionate, empathetic, and even when I was ringing out with I was feeling pains down one side, that the reassurance that they gave me, they honestly do hold your hand every single step of the way, and I feel like they lived the journey with us.
So I've had several treatments with Care. I now have a baby, and that's taken a number of treatments, fertility treatments, different alternatives, different medicines to try and get it to work for me. I have always said I would recommend Care Fertility. I would recommend them for the comfort factor that I received, the friendliness, and just I think the word is my faith in Care Fertility.
Oh, great. Just setting things up. I've seen those patient videos quite a few times, but they move me every time. So as we heard, around 1 in 6 people need help starting a family, and we do truly believe that family is for everyone, and we help all different types of patients, as you saw from that video. So during this event, we're going to mainly focus on the general IVF process. But whether you have treatment with your own eggs and own sperm or with help of a donor, the principles are the same. So I'll just go through a few slides. Here we go. So we've got fertility clinics across the UK and in Dublin, and several satellite facilities which feed into them. And with this arrangement, our patients get the benefit and the knowledge pulled from a huge group of fertility experts. But they also get, I think, the local friendly clinic facility. So hopefully the best of both worlds. And it's really easy to get started with Care. This is Shah, who we'll hear from a little bit later on in one of our videos. We have a new patient inquiry team who are really friendly and knowledgeable, and they can answer all your questions about getting started. And as I said, they're on the lines till 8 o'clock this evening. So our new patient inquiry team leader, Lauren, if she's part of this team, I think she's with us tonight answering questions live right now. Yes, she is. Thanks, Lauren. So getting the right diagnosis and gathering information from you is really important, and that means that we can give you the best advice. And we have a secure online patient portal where all the information related to your treatment is held, so it's all in one place. And if you've had previous treatment or test results, they can easily be uploaded into this portal, so there's no need to repeat tests unnecessarily. And all of this information is reviewed by one of our consultants prior to your consultation appointment. And here is George, one of our consultants from Care Sheffield. So in your initial consultation, your Care Fertility specialist is going to listen to your fertility plans and wishes and go through any existing test results. And then they'll explain if there are any other tests that would be beneficial to you. And your consultant will discuss the different type of treatment options and the chances of success with each of them. Often patients are faced with some decisions regarding which treatment pathway to follow. So we're there to give you all the information that you need to help that decision. So the intention is that when you go away from this consultation, you have all this information about your options for you to consider in your own time. And you can be assured that the support is there from the team to help you make that decision, discuss all the costs, all the implications, and just to help you make that very important decision. And whether your diagnosis is simple or complex, we have the depth of experience to give you your best chance of starting or growing your family. So after your consultation, our clinic teams are available still. If you have any follow-up questions, I can imagine once you get home, you might think, I should have asked this, I should have asked that. Well, that's absolutely fine. We've got people there waiting to support you all the way through. So starting treatment, we're going to go now through the IVF process, right from the start through to embryo transfer. And of course, everyone's treatment needs are different. and we pride ourselves in offering very individualised treatment. So from quite simple intrauterine insemination, for example, right through to technologically very sophisticated, advanced and complex treatments. So let's just spend a few minutes walking through the key stages of treatment. So the first one is ovarian stimulation. And this here is Di from Care Tunbridge Wells. And the first stage of IVF treatment is ovarian stimulation. So it's where we prescribe medication to stimulate the ovaries to develop follicles from which we can collect eggs. And everyone's issued with a medication protocol, which one of our expert nurses will explain to you, goes through it very simply, how to administer this series of injections. And to support that, we've also got some online injection teach videos to remind you, so you can follow along from home if you wish. The next step is monitoring. So this is Rima from Care Birmingham, and we monitor the development of the follicles using ultrasound scan. And this monitoring phase usually lasts between 3 and 7 days, very much depending on the patient. And when we're happy that the number and the size of the follicles is sufficient, then we'll ask you to have a final trigger injection, just to help with the maturation of the eggs, just to help them get ready to meet the sperm. This is usually given in the evening, and your egg collection will be scheduled for around 36 hours after that. Now, the egg collection is a straightforward procedure. We use ultrasound guidance and a needle to reach the follicles on the ovary and carefully extract the eggs. It takes about 20 to 30 minutes on average, and this egg collection is usually followed by a short rest before you go home, usually with a mild sedation. So it's very much a simple routine surgical procedure. If you're using donor eggs, then we usually would thaw them around the time that the sperm is being produced or prepared. I'm doing well driving these slides. It's quite complicated, but I'm getting it. They trust me with a microscope and micro manipulators, but then now driving this, it's quite tricky. But yeah. So sperm collection, and I've got a video now. Let's see if we can do this of sperm collection. The sperm sample, as I said, is generally prepared around the time of the egg collection. So currently, you can probably imagine we're minimising footfall because of COVID safe practice. So we are inviting people to produce samples from home. But the sperm may have been frozen, maybe surgically recovered, maybe partner sperm, donor sperm, but the preparation of the sperm is mainly performed in the same way. And embryologists at Care, they always talk to patients once we've prepared the sperm and the eggs, so we can advise on the next steps and talk about what's going to happen, the magic that's going to happen in the lab. I'm going to try and share you a little video of the sperm. Here we go. That's it. Just watch them for a moment. All right, just go back to the slides. So the next step, it's the all-important fertilization. We can aim to fertilize the eggs either by IVF, in vitro fertilization, or by ICSI, intracytoplasmic sperm injection. And IVF is where we mix the eggs and sperm that we've prepared and we leave them overnight, hopefully, to fertilize. Whereas ICSI is generally used when the sperm numbers or the sperm quality is lower. And in that case, we inject just a single sperm very carefully into the center of each egg. Oh, we've got a video. Let's see. So we should have a video of the ICSI procedure. Here we go. So you can see here the needle on the right-hand side with this tiny sperm being held carefully inside. We push the needle into the middle of the egg. We gently aspirate, that's just a bit of suction, to break the membrane to allow the sperm to be placed inside. Okay. And here it's Lena, one of our embryologists at Care Nottingham, sat at the micromanipulator, which is where we perform this ICSI. So then we check for fertilisation the day after the IVF or the ICSI, and we'll contact our patients with the news. It's almost always good news. So more than 95% of our patients will receive confirmation of fertilisation when we've performed IVF and ICSI. So very, very likely that we will have good news that there will be fertilisation after we've done the IVF or ICSI. Next phase would be embryo development. So following the confirmation of fertilisation, embryos are left mostly undisturbed for several days in our specialised culture medium in dishes which are electronically tagged, so they're uniquely identifiable. We know we've got full traceability and identification labels, of course, and we aim to perform embryo transfer at the blastocyst stage. So this is around 4 to 6 days after the egg collection. And most patients are fortunate to have several embryos to select from, and it's really important that we have methods to ensure we choose the best embryo first time. It means we get the chance of pregnancy is the highest in the first cycle when we choose the best embryo first time. And this photo here is of Alex. She's our London lab manager. Actually, she's on maternity leave at the moment, but looking at images of developing embryos. So I'm just going to talk briefly about two of the ways that we assure ourselves at Care Fertility how we're choosing the best embryos. So the first one is something that I'm very proud of, Care Maps. It's unique to Care, and it's the product of a decade of research and development. In fact, I did my PhD working in this area. We've used time-lapse imaging to monitor tens of thousands of embryos, and we've compared the patterns of development between the ones that have been successful and resulted in a baby and the ones that haven't. And we've seen differences in the patterns, quite subtle sometimes. So we've developed a tool or an algorithm to tell us which embryo from a group has the best chance of becoming a baby. And of course, we choose that one. PGTA is another technology which I don't have a picture of, is mainly used for women over 37 years old, because as women get older, their egg quality declines and the number of chromosomes in the eggs can be incorrect. And it's called aneuploidy, and it can result in failure of the embryo to implant, it can result in miscarriage, or even a child with an infected condition. So our talented embryologists can remove, you can see on the picture on the right of this slide, they can remove a small number of cells from the advanced stage embryo, the blastocyst, and send it for testing. And the result is used to help classify the embryos and again to see which is the best one for transfer. So one which is euploid, we've inferred the euploid from the biopsy, has the correct copy number of chromosomes. So they're the ones, the euploid ones, are the ones that we're going to select. So PGTA is not offered to everybody, but if our consultants think you would benefit, then it will certainly be discussed in your consultation. The next phase, embryo transfer. So irrespective of how or which embryo we've chosen, we use the same method to transfer it. The embryologist loads the embryo into a really soft, fine catheter, and it's then inserted through the vagina, through the cervix, into the womb, the uterus. It only takes about 10 minutes, and you can normally go about normal activities afterwards. Some people prefer to rest, but we'll give you the advice when you come and see us. Then we have the 2-week wait after embryo transfer. This is a picture of the embryo transfer procedure. And then we have 2 weeks of waiting for the pregnancy test. So before you go home after your transfer, we just talk you through what to expect over the next all-important 2 weeks before you take the pregnancy test. And we generally provide progesterone medication to support implantation during this stage of your treatment. So the pregnancy test is taken at 14 to 16 days after transfer. If it's positive, come back to the clinic for a scan a few weeks later. And if it's negative, then we offer support. We have counselling services available, and we'll also arrange a follow-up appointment to talk about the next steps and how the treatment has proceeded so far. And we move on quickly to donation. We've got a large team of donation and counselling specialists at Care, and everything is in place should you need to use donor eggs, donor sperm or donor embryos. And our donation team has over 25 years of experience and have actually helped more people start a family with a donor than any other UK clinic. Really experienced team. And they will support you through the entire process, from the initial questions right through to help selecting a donor and then moving on into treatment. So just a few words about the support that you receive at Care Fertility. We offer free counselling appointments, and we've introduced a Care Buddy programme to link you up with people undergoing treatment at a similar time as you are, if you wish. We also hold regular online support groups, although hopefully we're going to be meeting up face to face pretty soon. We have 24/7 Care online forum for you, so if you could chat online with other patients, and all of this continued support that I've talked about with the care teams, of course. We're here to support you not just medically, emotionally, but also financially. We've just developed Care Pay, so this is exclusive and individually tailored IVF funding package. So it's designed to help patients have a financial peace of mind, knowing that a plan is in place to help fund the treatment. We've created this actually following patient feedback, and it's managed entirely by our in-house team. So our patients have a more seamless experience, and their treatment is kept personal and private. So we've got 3 Care Pay programs, and they all include cycle monitoring, so that's the monitoring during the stimulation that I spoke about earlier, the egg collection, all the embryology, including the care maps, so the algorithm to choose the best embryo, the embryo transfer procedure, and freezing and storage, as well as unlimited embryo transfers. So we're going to move on now to our first Q&A session of this event. So just a reminder, we've got our new patient inquiry team available until 8 o'clock. If you want to ask questions live, you can use the chat or the questions tab, or if you prefer, you can email us at events@carefertility.com. So Professor Charles Kingsland will be joining me soon, and we're going to try and answer some of the questions that you've sent in for this event. We've got, I've got a big list, we'll just wait for him. Do I need to close this? Oh, there we are.
Good evening, Ali.
Good evening.
That care map still amazes me. I think it's a fantastic, wonderful innovation. It's really helpful to doctors, and I'm sure the patients really respond to seeing those pictures, don't you think?
Yeah, it's been amazing. Yeah, we've had so much positive feedback from it, and yeah, we're all learning from it. You know, we trust the algorithm because it's built on so much evidence and data, but we still see things that we've never seen before, and so it's just it's full of information, and it helps us to, we've seen most of it before, of course, and we can talk to patients about why things are going the way they are, why we've chosen one embryo over another one. And as you say, for the clinicians and the nurses as well, it's so informative. Yeah, it's brilliant.
Yeah, I find that it brings the science into the clinic when our couples can actually see how their embryos are developing, how they grow, how they develop. It gives us all a better understanding of what's going on, and often if you just show their development to the patients, they can see and understand what's been happening, which is very helpful.
Yeah.
There's a load of questions here.
So yeah, stop chatting. Let's get on with the question.
Yeah. Okay. There's one here which I thought was quite an important one. It says, Charles, I've had 14 rounds of Clomid with an ectopic pregnancy in between where I lost my fallopian tube. That's really tough, that. Clomid, I'd like to know if all Clomid tablets have damaged my lining of my uterus, taken all my eggs, or damaged my chance of IVF working. Well, Clomid is quite a powerful fertility drug, and what it does, you take it at the beginning of your cycle, and what it effectively does is to cut off the messages between your brain and your ovary, and it makes your brain think that your ovary has stopped working. So your brain drives the ovary harder to make it release 1 or sometimes maybe 2 eggs. But the thing about Clomid is that it usually works after 6 months of treatment. So we would not normally encourage patients to have more than 6 months of treatment, because if it's not worked after 6 months where you've had proven ovulation, it's probably not going to work, and it can be counterproductive. So I would say that 14 rounds now is enough. If it's not helped you have a live baby after 14, it probably isn't going to help. However, you have been pregnant, which is a good sign. Unfortunately, it was an ectopic in which you've lost your fallopian tube, but even more reason to go on to IVF. So you need a bit of a break after the Clomid. It wouldn't have taken all your eggs. It wouldn't have done you any good by taking it for over 6 to 9 months, but it won't have damaged your chances of IVF working. So I wouldn't worry too much about that, but press on with the IVF and hopefully you'll get success.
Oh, that's good to know.
Yeah. I was just, oh, sorry, Ali.
No, I was going to say we could just talk about some general principles. A lot of the questions here relate to chances of success, and it's a difficult one because so many factors play into this. So the best thing, rather than us to try and say your chance is this, your chance is that, it's really genuinely to have a consultation, get face to face with the detail, with the test results, so we can really advise you on an individual basis.
Absolutely. The whole key to IVF is to individualize the treatment, and that's what we do at Care. We treat everybody as an individual. You all have your own story and you all have your own journey, and it's up to us to help you, to give you the best treatment that will give you your best chance of achieving a pregnancy. But there are some things that you can always do to help yourself. And things like, we've gone through this many times before, and I'm sure I'm preaching to the converted, but things like stopping smoking, reducing your alcohol, trying to get your body mass index to the best it can be, so that you're not too overweight. I know it's very difficult to lose weight, but it definitely has a beneficial effect. Things like that. Take your folic acid as well. They're the key things to do to make yourself fit for fertility, give yourself the best chance before you get to the clinic.
Yeah, the folic acid is a very well established, evidence-based accompaniment to treatment, prior to trying to conceive. But what about any other medications or and things like this, Charles? It's very easy to get influenced by different social media or adverts or health food supplements that give you the impression that without these particular therapies you're never going to get pregnant. But it's all down to evidence-based. Which treatments are unequivocally of benefit? So things like stopping smoking, unequivocally beneficial. Cutting down alcohol, unequivocally beneficial. Taking folic acid, unequivocally beneficial. There are other things, though, that in theory may be of benefit, but have never been proven scientifically. Things like DHEA, oxycodone 10, these sort of things that you can buy from health food stores, and they are in theory beneficial, but not been proven. But there again, provided you're given the right information and you know that they're not harmful, it's really up to you to decide what is best for you. I use the example royal jelly. Now, royal jelly, that sounds good. Jelly made by bees, reassuringly expensive. Buy it from a health food shop. Never been shown to be a benefit for anybody. It's a treatment looking for a disease. However,
it's not harmful. It may make you feel better, and if that's the case, why not take it? But these are the things, the pros and the cons, that you've got to decide. And it's best not to just resort to social media. Have a word with your local fertility specialist or your local clinic. Should I be taking royal jelly? And they are DHEA or all the other hundreds and hundreds of medications that, quite frankly, I get confused about. So and I've been doing this for 35 years. So heaven knows what some patients coming into it for the first time. So get the information, give us a ring. It doesn't matter if you think your question is trivial. To us, if it's important to you, then it's important to us. And you've got the phone number there. Our specialists are there to advise you and point you in the direction that you need to be going in.
Yeah, great. This, just while we're on that, so we've got to get through quite a few questions, but how long before treatment should we be making these lifestyle changes or taking any supplements that we've been recommended to take by a fertility expert?
Well, as soon as you possibly can. I'm always a firm believer in protecting your fertility, and it's always a good idea not to damage your fertility prematurely. So if you're thinking of wanting to start a family, then and you're beginning to try, you may be trying for a couple of months, then take your folic acid, stop smoking, these sort of things. It's never too late to stop things that are not good for you. Have a good diet. Going back to all these food supplements, they're not individual, like, for example, walnuts and avocados. Do you really think that eating walnuts exclusively is somehow going to improve your fertility? No, it's not. However, if you eat these things like avocados and walnuts and all these fruits and berries, the chances are you've got a good diet and you're not eating cheap burgers and loads of fatty chips and things like that. And having a good diet, of which nuts and berries and these sort of things are part of, is good for you. So it can never start too early. But really, if you are thinking about starting a family, the earlier you start modifying your lifestyle to prepare for a pregnancy, the better it is.
Good. Well, if you could start thinking about this question while I just talk a little bit about embryo quality, Charles. The question is going to be about how many injections a patient may need to have in total before, during a cycle of IVF. Someone probably maybe a bit, understandably, maybe nervous about injections. So if you could just tally that up while I just talk briefly about embryo quality. So there's a question asking, I think they'd had 3 treatment cycles with poor embryo quality. Yes, is there anything they can do? Well, it's a difficult one, but we have extensive experience and a big toolkit. So we'd need more information, but we would individualize the treatment knowing that there may be an issue with embryo quality. So we can look at the drugs that we use to stimulate, or that had been used to stimulate the ovaries in those 3 cycles. We might be able to do some fine tuning of that protocol. We've actually got some very specialized culture medium that we can use when we've had poor embryo quality or failed implantation. We've also got a new method to prepare sperm so that we get the very best sperm that have no damage to the DNA. They're the best sperm, the most mature, and with the DNA intact, because DNA fragmentation in sperm can impact embryo quality. So we can select those best sperm for ICSI and do that. So it depends very much on individuals, but we've certainly got all sorts of armory to help with pretty much everything. And more than that, we've got this team. Even tonight on my lab manager's WhatsApp, the messages are coming in. Have you seen something like this before? What would you recommend? So we've got a big team of experts that work really collaboratively and all in the interest of the patients. We've all got the same aim.
I think that's really useful when we've got 21, 22 clinics across the country and over 40 consultants working, it's always reassuring that when we do get challenges, and we do get a lot, being the clinic that we are, it's nice to share those the information and get opinions from our colleagues, and we do that on a regular basis, just to ensure that we're fine-tuning the treatment that you might need, that just might make the difference. In answer to your question, Ali, I reckon it's between 15 and 20 on average. But don't forget, the vast majority of these, and it's never nice to have injections, but I always liked it to just being a diabetic for 2 to 3 weeks. Patients that suffer with diabetes are well used to injecting themselves, and the injections themselves are subcutaneous, so they only have to go in the fat underneath the skin with a very, very small needle, and hopefully that it's no more than 1 or 2 injections a day for up to 20 injections would be the average, I'd say.
Yeah, and it's a really fine needle. It's not.
No, it's not like a great big brain needle or something like that. They're only it's like a very fine orange needle that if you stick it in, it doesn't actually stick it into the fat under your skin. It doesn't even bleed. So it's not that bad. Right. Well, on that, shall we go to the short video? So we've got a short video which has been prepared by Shars, our new patient inquiry team leader. And she's going to tell you about getting started with care and how we support you through your treatment. Then we'll hear from Dave, Care's CEO, who will briefly describe life at Care and our dedication to supporting you. Then we'll come back for another 10 minutes or so of Q&A with Professor Kingsland. Thank you.
I'm Shar, and I manage Care's new patient inquiry team. We're here to make it easy for you to take your very first step in your fertility journey. We completely understand how nervous and excited you might be when you contact us. This is the start of a life-changing process and hopefully the beginning of an amazing future as a family. So it's really important that we give you all the information you need. That way, we can help you to feel much more comfortable and confident with your treatment. Whatever you need to talk about, I want to reassure you that no question is silly or trivial. We appreciate that there might be a lot to take in at first, but don't worry, we'll send you a clear information pack about the treatments you're interested in, and we're always here for any follow-up queries. My team also manage inquiries about Care Pay, our range of funding packages which are exclusive to Care Fertility patients. When you're ready, we can book you a virtual consultation with a specialist fertility doctor from your local care clinic. So, if you want more information, have a question, or wish to book an appointment, call my team. We want you to know that we are here for you at every stage of your fertility journey. We say that our patients become part of our care family, and it's true. We care deeply about you and your future, and our teams are here to make sure you have all the support you need.
The reason why we chose Care was just, one, the care that they give you, the aftercare that they have available to you, and the fact that they offer different forms of treatment, and they listen to you. One thing that I've identified and what I've noticed when speaking to other people that I've met within the infertility community is there's a lot of clinics out there that don't necessarily listen to you as the patient. It was kind of, well, one size fits all, but with Care that didn't seem to be the case at all. They took everything into consideration, they listened to your concerns, they listened to you as a person, and they put a package and a process in place that will help you, and, you know, fingers crossed, will give you that positive result from at the end of it. So without a shadow of a doubt, if I had to go through it again, I would definitely go back to Care.
Oh, the support at Care was brilliant, yeah. I mean, the nurses were brilliant for us. You feel so
looked after,
cared by the whole team. We felt that they did care, and it wasn't just for them getting something out of it. It was actually that
ongoing support.
Yeah, and they wanted it to work for us.
Care Fertility started over 20 years ago with one clinic and the goal of helping patients achieve their dream of family through truly personal care and the most scientifically advanced fertility treatments. We've grown from that one clinic. We now have clinics across the UK, and many people have become part of our care family with over 50,000 care babies in the world. But one thing has and always will remain the same. We care for each and every patient. We care about your dreams of having a baby, and we put our heart and soul into every aspect of what care can offer you. To provide you with the best care possible and to give you your best chance of success in treatment, we look to our own care family. From our consultants, embryologists, and nurses to our admin teams and specialist fertility counsellors, we've also put a lot of thought into how we improve each and every step of your journey, which will no doubt begin with lots of questions. We know that thinking about starting IVF can be daunting for some, and that's why our care, patient services and support teams will always be there for you whenever you have a question, need advice, or simply want someone to talk to, so that you feel completely confident and in control of your fertility options. So yes, we have grown and developed over the years, but care and empathy are always at the heart of who we are. We are passionate about changing lives and creating futures, and I hope that this shines through in everything we do and everyone you meet at all of our clinics. We don't just care, we are care.
There we are. We're back. That was good. You know, I've been working for Care for more than 20 years. Yeah.
Have you?
Yeah.
That long? I didn't realise. I didn't realise you were that old.
Yeah, thanks, Charles. Anyway, let's move on to some more questions. We've got loads of questions here. So someone's been through NHS treatment and all those tests that were required. So do they need to repeat tests and scans with us?
It depends how long ago they've been performed. Generally, I would say no, but there are some clinics that would wish to repeat them, particularly if they were, 1 or 2 years out of date. But if you've had them recently in an accredited laboratory, then they should suffice. But then, there are clinics will vary, but generally we would take into account the test that you've already done and would not want to repeat them as a rule of thumb.
Yeah. Sometimes we like to repeat a semen analysis, but yeah, again, it depends on how long it was since the last one, and also the result from the previous one.
Yeah, exactly. And the quality of the lab as well, really.
The question about male fertility supplements. The question is, do they actually work? The partner has severe asthenospermia along with teratospermia. So that means it's the percentage motility is down and the percentage normal shape is low. It says the progressive motility is 5%.
Yeah.
So is IVF the only option for them? Will the supplements work?
Well, it depends on the cause of the severity of the sperm abnormality. Sometimes, if for example it's been caused by a problem in childhood, like undescended testicles that have not been corrected, then it's unlikely that supplements will help. If it's been due to supplements that you've taken as part of your fitness training, particularly testosterone derivatives or steroids, which are not good for sperm. They may be great for muscles, but not good for sperm. That is reversible, and you don't need any particular. You just need to stop taking the steroids. There are some tablets, medications that may be of benefit, but like for example, zinc and vitamin E. However, you've got to be careful when you take things like antioxidants, like vitamin E, because if it's not beneficial to treat a problem without knowing what's caused it. It can actually be detrimental. I think, Ali, you probably have a comment about antioxidants and vitamin E supplementation and the tests that we can do to see whether supplements may be of benefit.
Yeah, and I think over the last couple of years, we've, as a field, we've become much more focused and knowledgeable about the male side of things, or the sperm side of things. And we've got, as part of the diagnostic semen analysis, we can do a sperm oxidative stress test, which is really informative, because if we know that there is a stress going on around the sperm, then we can treat it. We can try to treat it with antioxidants and make improvements. And the other thing I was just thinking while you were talking there is, I think people think if they have a poor semen analysis, that's it for life. But actually, we see that semen parameters can really fluctuate over time, because the guys are making the sperm regularly, and so we can see sometimes really severely low counts or poor motility, and then 6 months later much better, which often is to do with lifestyle, but it also may be post-viral. So we've seen some reports about the effects of COVID and other viruses.
I've seen chaps produce samples when they've had a severe viral infection like influenza or something, and the count's been 0, and then they repeat it 3 months later when they're feeling better, and it's completely normal. Having said all that, if you do have severe sperm abnormalities, then ICSI can be a fabulous treatment. And I've, in my professional lifetime, I've seen huge changes where, in the early 1990s, for example, there was no treatment. Nowadays, it's a routine treatment for people with, for men with severe sperm abnormalities, and you get healthy babies, particularly if the female is highly fertile, then the problem is solved with ICSI. But like all these things, the best thing to do is to latch on to your clinic and get the advice that you need as an individual, and point you in the direction to give you the optimum treatment, so you can get to your family as quickly as possible.
Yeah, do you know, we've nearly been going for 50 minutes, and I said we'll be 40 minutes, so we better start timing it up.
Okay.
So any of the questions that you wanted to just quickly tackle? Or?
Charles, any male fertility supplements? We've done that one. How many injections? 50 and 20. Charles, how many injections need to be administered?
No, we've done that one.
Natural killer cells. Well, that's we do. Do you test for natural killer cells, please? Yes, we do. We have some world authorities on natural killer cells. If you want to inquire, we have Professor George Nduque, who is a very well-respected expert on this, and he will give you a balanced view. I think that's probably. Oh, there's just one more about low AMHs, but have we got time to talk about that? Very quickly, this lady's AMH has come back as quite low, and her age is 37. If your AMH is low in 37, it doesn't rule out your chances of having IVF. It reduces your chances, but again, seek expert advice quickly, because the most important thing is you're 37. So we need to get you treated before your AMH goes down even further, which it does as you get older.
Perfect, thank you. Well, thanks for joining us, Charles. Great
Q&A
as ever. Coming to the end now, so I'd like to leave you all with a few final words about care and how you can get in touch to learn more or book a consultation. And don't forget, we will get back to you with answers to all of your questions. Our inquiry team are still available till 8 o'clock tonight, so they're there waiting for your calls. I'll just sign off with a final video.
Bye, everybody.
Thank you.
1 in 6 people need help to grow their family. You're not alone. And our Care family will do everything we can to help your dream of family come true. There are over 50,000 Care babies in the world today. And behind this success is our promise to make more heartfelt dreams of family become reality by ensuring our care goes into everything we do for all our patients every single day. You will receive truly individualised treatment, a patient-centric approach with empathy at its heart. We understand how nervous and excited you might be about getting started, but you can be assured of kindness, empathy, and all the information you need from our new patient inquiry team. We are all here to make it easy for you to take your very first step in your fertility journey. Call our team on 0800 564 2270 to learn more and book an appointment. We don't just care, we are care.
Many thanks for joining us.
Thanks again.
Bye.
Bye.